Okay, macular degeneration is also known as age-related macular degeneration, AMD. Is the deterioration of the macular, the area of the central vision, and can be age-related or exudated. It is a leading cause of blindness in individuals in the United States who are 65 years of age or older. There are two types of age-related macular degeneration. It's called dry and wet. Dry AMD is more common type of this condition. It is caused by a slow and gradual blockage of the retinal capillaries by pigmented residue in the photoreceptor waste products in the retina, allowing retinal cells in the macula to become ischemic and necrotic. Central vision declines, and the patients describe mild blurring or distortion at first. Night vision is impacted, and the ability to see clearly when reading is impaired. Eventually, the patient loses all central vision. That's seeing straight ahead. Dry AMD progresses at a faster rate among smokers than among non smokers. Individuals with diabetes, hypertension, and high cholesterol are at a risk for developing this condition. Other risk factors include being older than 60 years old, being Caucasian, and having a family history of AMD. Wet AMD progresses quickly. Patients experience a sudden decrease in the vision after a detachment of pigment epithelium in the macula. Newly formed blood vessels, which have very thin walls, invade the injured area and cause fluid and blood to collect under the macula. It's like a blister with scar formation and visual distortion. Wet AMD can occur at any age, in only one eye, or in both eyes. The patient with dry AMD can develop wet macular degeneration. So, assessment: an eye care provider will likely conduct indirect um, to assess for gross macular changes, opicities, retinal concerns, and hemorrhage. IV fluorescein angiography may be performed by the eye care provider to locate leaking vessels, and Amsler grid tests may be conducted to demonstrate visual central vision field loss. Dry AMD has no cure. Management in the community setting is focused on slowing the progression of the vision loss and helping the patient maximize remaining vision and quality of life. The risk for dry AMD can be reduced by increasing long-term dietary intake of carotens, and lutein and the zeaxanthin. Zeaxanthin. So we need those in our diets. So you're like, well, what is that? Well, you can either look it up, or that's like your squash, your carrots, your green leafy vegetables, your broccoli, your healthy foods. Okay, that will help slow um, the the development. Central vision loss reduces the ability to read, write, recognize safety hazards, and drive. So they suggest large print books, public transportation, and refer to a community resource that provide adaptive equipment. Management of patients with wet AMD involves slowing the process and identifying further changes in visual perception. Fluid and blood may reabsorb in some patients. Laser therapy to seal the leaking blood vessels can limit the extent of damage. Ocular injections with a vascular endothelial growth factor, such as these medicines, y'all can read on page 948. It starts with a B, and the other one starts with an A, like ranitidine. ranibizumab, and bevacizumab, and they can improve vision for the patient with wet AMD.